Nephrotic syndrome is the commonest kidney disease which afflicts 1 in 100,000 child population, and its prevalence is between 16 to 17 per million population, meaning thereby nephrotic syndrome is a disease of recurring or relapsing nature. The standard treatment for nephrotic syndrome, which begins between the ages of 2 to 5 or childhood nephrotic syndrome, is steroid therapy or oral prednisolone therapy. 90% of them respond, though the cause of nephrotic syndrome in these cases is not known, and hence it is called idiopathic nephrotic syndrome. 6 weeks daily treatment and 6 weeks alternate day treatment, which has been established since last 30 to 40 years, still holds good. There is not much change in the initial treatment. There is a new steroid which is available, which is called deflazacort, which is an oxazole derivative. It's a prodrug, but it has not been recommended for the initial episode of a nephrotic syndrome. While it can be given during adolescence because it has less cosmetic effect, it has less effect on the growth or the stature of a child, and it has also got a less effect on the bone densitometry and diabetogenic effect. So it is preferred if the child has got a relapsing nature. Now, regarding the vaccination in the nephrotic syndrome, it should be given when the course of the steroid is over and wait for 1 month. Live vaccines such as chickenpox vaccine and oral polio vaccine should never be given during the course of the steroids. DPT can be given if the child requires a booster dose while giving the alternate day treatment, because the small dose of steroid does not cause any immunogenic effect on the DPT vaccine. Injectable polio vaccine may be given during this period if required. Now, the most important vaccine is a pneumovax or the pneumococcal vaccine 23 series, because it is very commonly found that the nephrotic children are vulnerable to pneumococcal meningitis, pneumonias, and many of the infections which are the cause of death in occasional case of nephrotic syndrome, including bacterial peritonitis, are due to these strains. So prevention is better than cure, and you can safeguard these children by giving pneumovax during the remission period. That means when there is no proteinuria and the steroid therapy is over. Other vaccines may be used, such as meningococcal vaccine and influenza vaccine, again to prevention from these diseases, but they may not be given to all the children.